Hi, Dr. Scott Jensen here. Well, spring has sprung, and with that, one of the most common complaints I see in the office is, Doc, you got to help me. I got plugged ears. Oftentimes, patients think that all I need is to take a wash basin out, irrigate the ears, and I'll clear things up. But that's not what's happening. I take out my otoscope, I look inside the external canals of the ears, and so frequently we see the eardrum, and behind the eardrum we see fluid levels. We see little bubbles of fluid. Sometimes that eardrum is infected and inflamed and all red because of that. But oftentimes there is no infection. There's simply the accumulation of fluid. You need to understand that the middle ear functions just like our maxillary sinuses. The lining of the middle ear secretes fluid, and if that fluid doesn't have a place to drain, your ears will be plugged. They'll be blocked. Your hearing will drop. You'll be going like that, trying to chew gum. Once we open up the eustachian tubes, which basically are the outlets for the middle ear, you'll feel better. But the eustachian tubes aren't opened easily, and the reason is because in the flush of spring, the eustachian tubes are one of the first targets of allergies. Oftentimes in medicine you'll hear us call them SAR or SAR or seasonal allergic rhinitis. Seasonal meaning seasonal, allergic meaning reaction to some pollen of some sort. And then, if you will, rhinitis, rhino, the rhinoceros, rhino means nose, rhinitis means a runny nose, an inflamed nose. So seasonal allergic rhinitis will oftentimes present with symptoms that center around the nose and the eustachian tube, but frequently the thing that will bother patients most is the plugged ear sensation. There's a lot of things you can do to treat this on your own without getting prescription medicine. I frequently tell patients the reason this is happening is because the allergies are inflamed by the pollen, which triggers the release of histamine in your body. You've probably all heard of antihistamines. You've heard of Claritin or Allegra or Zyrtec. You might have heard of Benadryl. Those are antihistamines. They work against histamine. Histamine is a molecule that causes leaky membranes and swelling and increased secretions in our body. Mast cells run around our bodies chock full of histamine molecules. When those mast cells are ruptured because of the immune processes, the histamine floods out into our bloodstream and causes symptoms in many places. Dry, scratchy eyes, runny nose, itching, sneezing, rubbing our nose like this. For asthmatics, frequently it'll cause wheezing and coughing, things like that. The best way to use an antihistamine is to prevent the histamine from getting released. So if you take an antihistamine like Claritin or Allegra or Zyrtec and think you're going to get relief after your symptoms have already flared, you're wrong. You're going to have to play catch up for a while. The decongestant, the Sudafed, those kinds of things can help. But Sudafed is problematic if you have high blood pressure, so you need to confer with your physician. But the bottom line is, if you know, as I do, that right around Memorial Day, the cottonwood trees are going to slough, I get on my antihistamine a few days before my symptoms flare. I'm ready with the decongestant like Sudafed or phenylalanine to use if I need a Sudafed or a decongestant to treat my symptoms. You see, there's two different things. There's the antihistamines, which are more preventive, and then there's the decongestants, which can help you. But you can also get over-the-counter nasal sprays, steroids, Flonase, fluticasone, Nasacort. If you use those preventively, do one puff in each nostril, oftentimes you'll stabilize your nasal membranes and you'll get a lot less symptoms. And if you get less symptoms in your nasal membranes, you'll get less symptoms in your eustachian tube. That's the way to deal with seasonal allergic rhinitis. Many of us, like me, will have seasons. I've got 2 or 3 weeks around Memorial Day, and then I've got another 2 or 3 weeks right around Labor Day when I see the goldenrod and the ragweed come out. Bottom line is, talk to your doc, do some reading on the internet, go on Google, but there are over-the-counter medications that you can use, and then the good old-fashioned try to avoid these allergens is a good way to go as well. I know for me, I frequently have gotten tremendous relief if I can get out of the environment I'm in and get into my car and have the air conditioning on. Frequently within 30 minutes I feel quite a lot better. I hope that helps. Thanks.